I've been here as a physician for 34 years. I've really enjoyed the smaller community, but yet we are close to the Twin Cities. So it's really kind of the best of both worlds for me, and I've really enjoyed it.
By being part of that program, the residents spend the first year down in St. Louis Park at Methodist, and they get high volume OB experience, pediatrics, neurology, and inpatient medicine.
Once we make that transition to the second and third year, it's much more clinic-centered. Some of the strengths of our family medicine program here, it is a small program. They're the only residents here, so they're really one-on-one with both the family medicine doctors and also the preceptors in their specialties.
The preceptors have been great. A lot of them graduated residency not that long ago, so they remember what it's like to be a resident and are really, really passionate about teaching. I also think that they encourage autonomy, coming up with a plan for patients.
Another unique feature is that the residency program is split between two locations, our location in Amery and Westfields Hospital and their clinic in Richmond. The residents get to see an older patient population at our site compared to more of a bedroom community in Richmond with younger, more employed people.
We have the advantage that we're close to the Twin Cities, so we have the backing of a large program like HealthPartners.
We have their care model process, quality improvement, all of those sorts of structures already in place, which makes it easier for us to have an excellent residency program. We have an embedded, strong behavioral health program. For a rural community, that's pretty unusual. Residents who come here will have a strong behavioral health perspective when they finish, which is always important.
And I worked a lot with the outpatient psychiatrist in the clinic out there, but I also had the opportunity to work with the inpatient psychiatry team, and I really enjoyed that opportunity to learn more about how to help manage behavioral health, since it is a large need in any community.
We do have wound care that's very strong here, which you may not see in other smaller programs. At one of our sites, we have a hyperbaric chamber.
We were the first location in Wisconsin to have hyperbaric oxygen treatment, and so kind of state of the art, and we're very proud of that.
We're also quite unique in we have a cancer center on site here.
I have had the chance to work with the oncologists here in Richmond in the infusion center.
For our cancer center, we have a healing garden that's connected to that so that patients and their family members can go out and enjoy that when they have to be here for hours.
The residents also can be involved with the Power Up program, which is a program to try to get youth and young people to eat more fruits and vegetables and to exercise more. That spreads out to the community, and we have a lot of organic farmers in the area, and we have a commercial kitchen attached to the Farm Table restaurant where they do cooking classes for the youth, and they can bring their parents and they learn how to cook all sorts of foods they can get from the farmer's market. So that's a very strong program, and we like to get the residents involved.
Being a small program, also we're flexible, we're nimble, so if we have some things that we want to try to improve in, we can make changes and improvements kind of on the fly.
My ER experience and my clinic experience are two of my favorite experiences. I really like in clinic that my schedule is usually full and I get to see a variety of patients each day. And then when I'm on call, I spend time in the ER, which is really good because then I get more experience with acute sicker patients. And also you get more experience with experiences that are harder to get in a clinic setting that I think are really beneficial and have made me more confident in a lot of my skills.
A lot of opportunities to get involved in the community, which I think is really important in a rural program, because when residents graduate and get out into doing rural medicine, they are going to be involved in the community, and you're going to be looked at to maybe do a lot of other things that aren't necessarily just medicine. It's a learning experience, obviously, first and foremost. We really kind of promote that work-life balance. We want to make sure that there's life outside of work.
More frequently, we get together just as a group of residents. Like next week, we're planning on going kayaking.
Amery is known as the City of Lakes. We have 3 lakes within city limits and numerous lakes outside of town, which makes it a great recreational community.
So we're close to a metropolitan area, which makes it easy if you wanted to get into some cultural events or professional sporting events, you can do that, but yet you can remain in the rural community and never have to go into the cities if you don't want to.
If you're considering rural training, I highly recommend it. I think you get a really good variety of experiences in the rural setting. You get a lot of experiences with different procedures if that's something that you're interested in. The community support is really valuable. I feel really supported in what I want to do and what I want to accomplish in my practice here at this program, which was really important.